Good day, this is Dr. Miguel M. Morales, and I will share with you this lecture regarding utilizing model for improvement in achieving sustainable outcomes. For our learning objectives, number one, determine the different steps of model of improvement in the context of your organization. Number two, demonstrate the step-by-step process in the model of improvement to address a common organizational issues. And last is to appreciate model of improvement in achieving a sustainable outcomes. Problem. First, you should define the problem. Based on your situation, you have the three areas. You have the field works, you have the admin works, and we have the clinic. So in the field works, no, there's delay in results transmittal, or there's a results issues. In admin, there's advanced cash advances issues, and even the liquidation process is an issue. And last is clinic. Why our patient had lost of follow-ups for our patients. So these are some of the problems based on your organizational issues. So these are the elements of system improvement. Number one is the will. You must have the will to improve. No? Even though you have the capacity, you have the structure, even you have a bright mind or brilliant minds, and you have the resources, but you don't have the will, there will be no improvement. Kung hindi mo gusto na magbago, the willingness to change something, it will never be a reality because at first there's no mindset of doing it. Second is ideas. Ideas, you must have ideas about alternative to the status quo. So at first, we deliver our results via snail mail. So through the technologies, we are using what? We're using emails. And through this 21st century technology, we are using what? Other means of communication, such as the social media, the Viber, or even the other different platforms. So you should have that creative mind. No? You have that mindset which nourishes creativity and innovation. And last is execution. Then you must make it real. So you have the willingness to do it, you have the idea, and now you should execute the idea. So through these three elements of system improvement, you will achieve change or innovative change. Again, you should have the will, idea, and the last is execution. In execution, there's a lot of challenges. There's a lot of resistance to change. But eventually, if if your members could see the outcomes of some of the changes, they will accept it. They will embrace it. So this is the model for improvement by Institutes of Healthcare Improvement. So number one, what's the aim? What are we trying to accomplish? What's your goal? What's your end in mind? Next is measure. How will we know a change is an improvement? It entails precise, accurate data collection and data analysis. And last, what change can we make that will result to an improvement? It is connected with your aim. So, what are these outcomes that will eventually observe in your organization, such as we identified the delay in the results transmittal. So our aim is should be within the scope of 2 days, maybe. And we measure that all of the results should be within 2 days. Okay? Then we check how we've come to that conclusion that we are using different platforms of sending their results. And last, we should test change. It's not only a 1 month gathering of data and checking of this. So it takes time for us to check if the change is sustainable. So PDSA cycle, or the plan, do, study, act cycle, is a quick references to a specific problem. It is only confined in a small scale. It's not a full-blown change of the organization. It will be entails in a specific unit, and eventually, if it's effective, we can replicate it to another unit. And PDSA cycle is an observation. You observe for the changes, you observe for, for the trends or the rates, and PDSA cycle is change. You change for something better. Based on your problem, we have difficulty in lost tracking of our patients. Why? So you may want to use other platform of a follow-up checkup, such as telemedicine. And last, PDSA cycle is testing. You test these changes, these innovative interventions, for us to check if it is sustainable. These are the processes. First is set an aim. What's your objective for the project? Next is establish measures. Measure entails specific variables, specific time frame, specific rates. Third is identify changes. How can you say that it is a change? Maybe a decrease in turnaround time of the results, and we have the turnaround time of cash advances, or even limiting those wastes. And last is maybe an increase in follow-up checkup of our patients. And we will test that change if it's sustainable. And last, we implement the changes. Setting an aim. This is the first step. An aim statement is the answer to the first question in the model for improvement. What are we trying to accomplish? So please be specific, because it will be the objective of the entire improvement process. What will be the improvement based on your problem? Okay, these are the elements of an aim statement. So number one is important issue. So based on our example, so we have delayed diagnostic results. So it means that there's the treatment will also be delayed, and it will result in a poor prognosis of the patient. Another issue is there's loss of follow-up of our patients. So pag kulang sa follow-up ang pasyente, hindi nagpa-follow-up ang pasyente, mamaya hindi na siya nainom ng gamot. Pag hindi siya nag-iinom ng gamot, lalala na yung kaso niya. So, here, it's an important issue. And it's taking its toll in our organization, because they are our client and they are our customers. Number two is specific and measurable. In an aim statement, you should have a specific and measurable variable, such as ilan ba ang target natin na mapa ah, mapabalik sa ating clinic. Ilan? 10, 20, 'di ba? So that it should be clear. So bago mag-create tayo ng isang improvement project, may 10 mga pasyente nagpa-follow up check-up sa atin. So what's your target for our project? Maybe a 50% increase. So dapat may 5 pasyente mo dadagdag kada buwan. So that's very specific, and you have a specific duration. And last is, who is accountable? So let the organization or the leaders or the managers took the responsibility, okay, on a specific aim. So, kunwari, tungkol sa last follow-up, no? I-increase natin ang follow-up na percentage for 50%, no? Every month. So, every month we will have 5 people who will do their follow-up check-up. So, sino responsible doon? So, yung may assigned doon sa specific area, such as the clinic. No? So, may contain information about key strategies and guidance for the improvement project, and not exchange background and easy to understand. So, these are some of the example. So, we have a case in 2005, the Saudi Aramco Medical Services Organization, a complex hospital in Saudi, set out to reduce the rate of central line infection in its neonatal intensive care unit, a unit dedicated to treating very sick newborn babies. For every 1,000 days, the patients were equipped with central lines, or in medical terminology, catheter days. There were about 11 related infections. So our aim is to decrease the infection rate in the NICU from 11 infections per 1,000 days for fewer than 5 infections per 1,000 catheter days in 9 months. So that's very clear. We have a specific or important problem. We have specific and measurable variables, and we have the duration. Okay? Choosing measures. So how can we tell if change is or isn't an improvement? Track the effect of the change. In other words, we should measure it. So in measure, we have different types of measures or different types of variables. So based on this family of measures, we have the outcome measure, we have the process measure, and we have the balancing measure. For the outcome measure, it is the byproduct of the specific process. So, katulad kanina, our outcome will be the increase in what? Follow-up check-up, no? Mas lalong tumataas yung follow-up check-up. What's the process? Process is the step-by-step process or the step-by-step interventions you've incorporated in the new process, such as you will give them an email, send them an email, send them an SMS or text messages, or even follow up them through social media. That is the processes. That is the new interventions. And we should check their compliance. No? Ilan ang tinext natin, ilan ang ating in-email, at ilan din ang ating messenger sa kanilang social media. So these are our processes. And last is balancing or indirect measures. Hindi siya direktan makakontribute dun sa follow-up check-up, but tulad ng ilang percentage ang walang may cellphone, ilang ang percentage na laging brown up, di ba? So, yan yung mga balancing measure that could indirectly contribute to the process or the outcome measures results. Okay, these are some of the examples of our measures. So let's read the aim. The aim is arrive on time for work, class meeting, and other appointments 100% of the time within 3 months. So very clear aim. So the outcome measures percent of the time you arrive punctually. So kailangan hindi ka malate. That's the outcome measure. The process measure is number of days or week you wake up early for work, meeting, or other appointments. And the balancing measure is level of perceived sleep deprivation on a scale of 1 to 5. Diba? The process measure, ilang linggo na lagi kang gumigising na maaga because it will directly contribute to your outcome. But the balancing measure is nararamdaman mo sleep deprived ka ba, di ba? It's the indirect measure. Next aim is decrease the average of HbA1c level of the population of patients with diabetes to less than 7 within 12 months. So our outcome is HbA1c level for patients with diabetes, di ba? Yung outcome is yung mismong result ng HbA1c. Process measure, the patients whose HbA1c was measured twice in the past 2 years, and the indirect measure or the balancing measure, number of minutes spent with each diabetes patient. No? Again, the outcome is yung pinaka-resulta. The process is the compliance of different interventions, and balancing measure is indirectly affecting your outcome or your process measure. Again, case analysis. So we have aim to decrease the infection rate in NICU from 11 infection per 1,000 catheter days to fewer than 5 infection per 1,000 days in 9 months. Our outcome measure will be the rate of infection or the um, CLABC, okay, or the catheter-related bloodstream infection. Our process measure will be the use of checklist, the use of central line bundle. So, check natin, naghugas ba sila ng kamay, sila ba ay gumagamit ng sterile items. And the balancing measure is duration of bedside care and procedures. Probably, pag tumatagal sila, nagiging unsterile na yung mga equipment or yung mga ginagamit natin. So, again, these are the outcome measure and process measure and balancing measure. So how will you achieve your aim? So what are the changes can we make that will result to an improvement? So we can use these strategies. Number one, benchmarking. No? I-check mo, ano bang ginagawa ng ibang bansa? Ano bang ginagawa ng ibang ospital? No? Sa inyo, no? Sa inyong um, situation, based on the low turnover of the follow-up check-up. So ano bang ginagawa ng iba? Anong ginagawa ng ibang community? What they are doing? So benchmarking is very important for us to check if we are doing our intervention well enough or we can do more at present. No? May mga bagay-bagay na pwede natin gawin. Next, creative thinking. Sabi nga lagi natin, think that there's no box for us to elicit innovative mind. Isipin natin, paano kaya yun? Pwede kaya na bigyan natin ng incentive kung makakompleto niya yung, kunyari, 5 araw na follow-up check-up niya? Para katulad sa ating mga sikat na kapihan na merong stickers. And on the last day, we'll have what? Prizes and awards. So, think that there's no box. Katulad nun, delay. No? Pwede bang isipin natin ano pang pamamaraan para ma-send yung ating mga results? Based on your cash advances. Maybe we can use cashless, GCash or whatever, and maybe it should be audited not not only in a quarterly basis, maybe in a weekly basis for you to check and the allocation of your budget. And last is use of technology. Use of technology, it bridges the gap of a problem and a specific solution. Tulad nga nun, di ba? Loss of follow-up check-up. Maybe you can use social media as you can create a group for you to remind them time to time. A Viber group or even a email maybe or SMS. Again, think that there's no box for you to elicit and nourish your creative mind. Change concepts. So, dapat naiisip nyo to. No? Pag kayo ay mag-create ng inyong mga intervention that will be used on a specific problem or a specific project. Number one, you should eliminate wastes. So, sa sobrang dami ng inyong process, no, inilatag niyo yung process niyo, no, sa paggagawa ng follow-up check-up, ang dami, 10 proseso yan. So, ang mangyayari, ang mga pasyente, tinatamad na yan. So, eliminate waste. No? Ang waste kasi hindi lang pinag-uusapan dito pera, pero panahon, oras. No? Number two, enhance the producer-customer relationship. Tayo, dapat magkaroon ka ng magandang rapport sa iyong pasyente. And eventually, if you get their trust, no, they will comply a lot higher percentage because kilalang kilala mo sila. So, in terms naman dun sa delay of the results, may possibility that you should talk to your laboratory technician or your medtechs. So, kailangan mapag-usapan natin. Baka may mga issues, no, in between of your departments. Change the work environment, no? Challenging, no? But eventually, because of the shift from a face-to-face manner to telemedicine, so as nurses, no, as healthcare providers, we should embrace change, and it includes your environment. Now, we're not only dealing with the physical environment, but now you should also manage the virtual platform. Manage time and variation. No? Again, it is related to elimination of wastes, because if you have a lot of dead air or dead time, so there will be what? Conflicts. There will be resistance to change. Sasabihin ng mga staff mo, bakit gagawin namin yan? Mas tumagal, di ba? Masayang yung oras namin. And design system to prevent errors. Again, if there's no policy regarding follow-up, check-up, work instruction, even process flow, try nyo gumawa. And eventually, kung standardize yan, mas madali nyo siyang ma-measure. Okay? These are the change concept that can be included and can be a basis for your innovative interventions. So, again, this is one of the techniques. How will you resolve a specific problem? Do a root cause analysis, Ishikawa diagram, or even the cause and effect diagram. No? Alamin natin, ano bang punot dulo? Bakit hindi bumabalik yung ating mga pasyente? Ano ba yung punot dulo? Bakit nade-delay ang transmittal ng ating mga results? Alamin natin, no? Para tayong bata, no? Tayo ay we have that questioning mind, no? Bakit? No? Sige, gawin natin example yung delay ng results, no? Bakit na-delay ang results? Kasi ipiniprint pa. Okay, bakit pa ipiniprint or bakit na-delay? Kasi sira ang printer. Sir, bakit sira ang printer? Kasi hindi pala siya na preventive maintenance. Bakit wala na preventive maintenance? Kasi wala palang polisiya regarding preventive maintenance. Okay? Number 1. Number 2. Bakit delay ang result? Kasi hindi alam kung kailan dapat talaga i-release yun, yung result. Bakit hindi alam kung kailan i-release yun? Kasi base lang, no, sa kagustuhan na magre-release. So, dahil base lang sa kagustuhan nag-release, bakit? Kasi walang sinusunod na process or walang procedure. So, dalawa na yun. We have number 1, pwede nating improve yung preventive maintenance ng ating printer. At number 2, pwede nating improve ang ating process ng releasing of results. Diba? Dalawa na yun. Again, this is the cause and effect diagram. Then now, we'll test our change, no, using the PDSA cycle for the plan, do, study, and act. So, let's start with the plan. Plan the test, including a plan for collecting data, state the objective of the test, state the questions you want to answer, and develop a plan to test the change. No? Again, balik tayo doon sa problema. Pabalik-balik tayo sa problema. Bakit na-delay ang pag-transmit na ating mga result? Okay? Sino, paano, at kailan, saan. Diba kailangan yung maging clear dito, lalo na sa pag-gather ng data. Okay? So, ito ba ay clinic to clinic? Ito ba ay from laboratory siya ang mag-manage ng data gathering? And after planning, you do it. No? Carry out the test. Okay? So, napansin natin, no? Maganda pala na gumamit tayo ng iba't ibang methodology. We have also review the policies. No? Naglagay tayo ng policies. Nilatag natin yung mga bagong polisiya. We test it. We train all of our staff. And i-test natin, carry out the test, document the problems, and begin to analyze data. So you plan, you do it, no? You change the policy, you train the staff, you also have a policy for preventive maintenance, you also train the staff. Now, you study it. Nung nagawa natin yon, we complete the analysis, anong nangyari? No? Okay? Lahat ba pumasok sa turnaround time na 2 to 3 hours? No? Nare-receive na agad ng ating mga pasyente or naka-accept agad natin yung mga results. Then compare. Okay? Sa 3 buwan, sa 6 na buwan, anong nangyari? Okay? Then summarize and reflect, and last is act. Oh, bakit biglang bumagsak? Ay, bakit biglang tumaas ulit? So, you act on it. No? Check natin, bakit tumaas? May possibility, sira talaga yung mismong printer. Or may possibility, walang internet nung panahon yon. Okay, nung araw na yon. So, you should check all of this. No? Kailangan natin i-document. And eventually, you will do again another PDSA cycle. Think ahead. Start small and get started. So hanggang umikot ng umikot ang ating PDSA cycle. Hindi natatapos sa isang PDSA cycle ang isang project. Eventually, it will move until you have maybe a PDSA cycle 5 for you to achieve the sustainable outcome. Think ahead. No? Kailangan mo ma-foresight. Ano yung magiging problema? No? Next is start small. Ulitin ko, kung sa isang branch nyo lang gagawin, sa isang branch nyo lang siya gagawin. Okay? Then, get started. No? Start mo na. Konti-unti. No? Hindi yung buo. Unti-unti lang. Kasi may konting resistance ang change. No? So, we have running concurrent test cycles. So, again, it will have different phases. No? So, hindi matatapos sa isang PDSA cycle. No? Maraming PDSA cycle for you to achieve your goal or your aim. Okay? Did you achieve your aim? So, after the different PDSA cycle, maybe a 5 or so, and go back to your aim. Napababa ba natin ang turnaround time? Mas napabilis ba? Mas dumami ba ang nag-avail ng ating follow-up check-up? No? Marami ba nagpa-check up ulit sa atin? So, doon mo malalaman if your intervention are effective. Okay, so to end this, I want to leave you with a quote from the quality improvement guru, uh, Edward Deming. Quality is everyone's responsibility. No? Hindi responsibilidad lang ito ng mga manager or ng mga field workers. It's a responsibility of all. No? Lahat tayo, responsibility natin yung quality. So, bawat step dun sa PDSA cycle, sa model of improvement, you should get involved. Kayo ay dapat sumama at makisama. No? Magsalita kayo. No? Speak up, no? Your ideas. Lalo na kayong nasa field. Kayo kasi ang gumagawa. Thus, kailangan maintindihan ito ng mga management para mas madali at mas mapabuti hindi lang ng welfare ng staff, but specifically our patient. So to that, maraming salamat and good day.